guys put the green bibs on. Greens are on first. Your team put red bibs on.
I've lived in the Wormhole area on the other side for 12 years. I've worked with the community for a solid 6 to 7 years now. I've got involved in so many various projects. A lot of parents would come up to me when they would receive letters from the school nurses saying that your child's overweight.
Legs out. No, that was good.
Obesity is essentially an imbalance of energy intake to expenditure, but we're starting to understand that there's lots of complex other factors which have a play, for example environmental and behavioural factors. Part of Olympics is trying to address many of these factors. A lot of research is now showing that you really need a whole system approach to tackle obesity.
It's really exciting to be able to work outside of the hospital because it gives us a chance to do something earlier. We don't have to wait for a child to get really sick before we can get involved. And that helps us to do much more preventative work. And prevention is so much better than cure.
Obesity is a major public health problem. Currently in White City, 1 in 5 children start primary school overweight or obese, and by the time they leave primary school it's 1 in 3. By the time to get to adulthood it's actually 2/3 who are overweight or obese. So we're really storing up problems for the future because this has serious long-term health complications for other non-communicable diseases such as cardiovascular disease.
I think White City is still one of the most financially deprived areas in the country, and certainly in London, which means that families don't necessarily have the money to look for healthy ingredients all the time. There's time constraints. There's lots of low-cost chicken shops, which means that often families, instead of choosing to cook at home, will choose to give kids money to go and get chicken and chips. And also, despite the work that the London Sports Trust and lots of our partners are doing, there probably is still a lack of free or low-cost physical activity provision in the area, which means that for the most part families can't access ways of being healthier that they can in other areas. Gyms are expensive, fitness classes are expensive, that sort of thing.
Everybody's going to take a shot at the basketball from this white line.
And what we tend to do is multi-sports activities where we have them playing a range of different kind of games, whether it be sports specific or just things just to get them moving. Our bodies are natural instruments, that's what we have to use.
So my vision for Parkview Olympics is that it will encourage children and families to be more active and to eat more healthily. In the long run, the benefits of that for health are enormous. We have this growing problem with obesity. We have people who spend so much of their time sitting down. Children are designed to run around and be active. They're not designed to sit playing computer games. So actually giving them the chance to experience the joy of being active and the healthy benefits of that is how Parkview Olympics could have a really long-term benefit.
It's important to remind them that they need to be outside and using their bodies, not only for physical aspects, but also socially, having them talk to one another and interact with one another face to face. You're also helping to maintain and develop those social skills that are important.
But this is the Safe Camp, so here we have provision for up to 150 young people from White City in all of the holidays. And London Sports Trust, Phoenix Academy and the police have been running this in partnership with QPR for the last, I think, 9 or 10 years. And the benefit of that for us is massive. First of all, it means that we can run activities here for normally about 100 kids each day.
We've been doing a lot this week, for example, multi-sports, bench ball, dodgeball, bike riding, football, basketball, and some fun games, trampolining, yeah, much more.
Okay, so I've got garlic, I've got some peas, and I've got some onions as well. So you can decide what you would like to grow. Would you like to smell it? Does it smell like garlic? I think it's a very strong smell.
Smells really good. Can I put it in?
I think it's very important to teach children about where the food comes from, teach them how to cook healthy meals as well. And we believe that introducing healthy habits into children's life at the very early stage will help them to make a better and healthy choices when they grow up.
So the root is here, the flat bottom here, and this is going, yeah. We need to make sure
I have
it's
the
planted
biggest
this way.
stem ever.
Hammersmith Community Gardens has been in existence for 34 years. We run a variety of programmes, not just for families, for people of all ages. We co-manage Phoenix School Farm. We provide families with opportunities to do growing and other activities during the summertime. We run an environmental play scheme in the summer at 3 of our sites, and we always include in that a trip once a week out to somewhere in the countryside, because I strongly believe that if you don't do it as a child, you're less likely to do it with your own children. But getting away from the city I think is really important. I think there's also a lot of peer support from families as well. I think that's all sort of embedded in what we try and do.
It was a surprise to me when I moved onto the estate that there was a nice little farm 2 minutes down the road from me. Both my children, there's a 6-year age gap between them, but they both enjoy going to the farm, and the benefits obviously are that they can see the seasons and what grows in different seasons. They can see where their food comes from. There's access to chickens and rabbits, which you wouldn't have ordinarily on an estate.
Sometimes the children come here and they don't know what a vegetable is in its raw form. They've never seen pets before. A lot of children have never handled an animal, or they don't even really know where eggs come from, and when they see the chicken and collect eggs, you know, it's mind-blowing.
What I think is interesting about Parkview is actually all of these activities are already going on in the local area, but it's bringing the organisations together. So what we're hoping to do by bringing organisations together is to help to support the environmental change and help people in the area become more aware of what's actually already available to them, to make people feel more empowered and more motivated to live a healthy life.
The idea came about that if we got a few other organisations involved, it might actually intrigue and help other people get on board and actually change the lifestyle. It's changing the lifestyle of children. And I met Beatrice, who's actually the Connecting Care Practice Champion Manager.
The most important people is to all the children that have actually been on the Parkview Olympics programme. I want to give you all a big clap, so thank you. And then I'm going to pass over to the practice champions, who are going to give you a little award and certificate.
Practice champions are volunteers. They're people in the community who belong to the local GP practice who want to do something to improve child health. It's really exciting because actually they know and understand their community and they really know what will work.
I think with a 6-week programme it's unrealistic to expect hard outcomes of changes in BMI, full-on behaviour change. You know, you need long-term programmes over a year to expect those kind of outcomes. But what we do hope to see is children feeling more motivated to take part in healthy activities.
I've always been an obese child. I always was bullied because of how big I was. And the only way for me to have lost weight was actually for me to have surgery. That is not what I want for children. If it's embedded in them now to change their lifestyle, they wouldn't have to face the choices I had to face and many others in losing weight.